Okay, so we have the chair of this session, that is the health status and behavior, is Professor Geeta Mishra. Professor Geeta Mishra's main research area is life course epidemiology and women's health. She is a professor at the University of Queensland in Australia, and the NHMRC Principal Research Fellow. So Professor Mishra is internationally recognized for her expertise in epidemiology and women's health, especially for her work on the links between reproductive characteristics and non-communicable diseases in later life, such as diabetes and cardiovascular disease. And as a discussant, we have Professor Tina Purnat. So Professor Purnat is a team lead for the infodemic management in the Unit for High Impact Events Preparedness at the Department of Infectious Hazards Management in the Division for Emergency Preparedness at the WHO. She's joining WHO, I think, on the 15th of September. She's currently with the European CDC. So Tina has worked for over 20 years at WHO, European Union, and academia. So her expertise amalgamates health research, analysis, and policy making with an emphasis on promoting the use of health information and evidence in decision making and for policymakers. As part of the WHO COVID response, she worked in developing and formulating WHO infodemic response and infodemic management interventions, for which she received the WHO Pathfinder and Innovation Award in 2021. Maybe we will start now with Professor Geeta, who is going to present some slides. Geeta, would you like me to share the slides from my side?
Yeah, if you want to do that, I can. Otherwise, I can do it too. Shall I do it, or do you want to do? You can do it if you want, Claudia.
Okay.
Otherwise, I can do it. Yeah.
Yes. Okay, I think he's still sharing yours, but should be sharing.
Oh, am I?
I think now you should see
now
mine.
It's good. Now it's good. Yes. Okay. So we'll just. Perfect. Okay. So good day, everybody. Before I begin, I like to acknowledge the traditional owners of the land on which I'm speaking today, the Yagara and Turrbal people. I also like to acknowledge their elders, past, present, and emerging. This evening, I'll be presenting the results from the thematic area 1, health, status, and behavior. It basically, what it does is that it raises questions, or it asks questions that explores the sex and gender differences in COVID-19 risk, morbidity, and mortality. It also talks about questions on the uptake of non-pharmaceutical interventions and vaccines and impact on non-COVID health outcomes. And you can see the coordinator and the main contact person really is Claudia for us. Next page, please. Next slide. Okay, so it's been Asha was saying it's about a year that this journey has started. There were 34 contributors across the different genders, regions, and organizations. There were more or less three evolving drafts of report earlier this year, in the first 3 months of this year. So just to recap, in this theme, we collected 41 research questions, and each of the research questions, the participants were asked to rate based on across three criteria, as what Asha was saying. The first one is that in answering these questions, how much will it impact, has potential health benefit? If these questions were answered, how would it improve? Will it improve gender equality and empowerment on all girls and women? And the third criteria was the urgency in answering these questions. The first two the potential health impact and the gender inequality, these scores have been combined, and I'll show you in the next few slides. You'll see there is, this thing has got 5 themes. One slide back, please, Claudia. Okay, so there were 5 broad themes looking at sex and gender susceptibility of COVID-19 infection and morbidity and mortality, and it goes right up to impact of non-COVID outcomes. And here we talked about sexual and reproductive health, but also mental health and other NCDs as well. Okay, next slide. Okay, so this is really quite a fast moving feast, because when I was summarizing the results yesterday, we had 99 participants. And then this morning, it was 111. So I had to rerun and get everything prioritized. So what you'll see is, and it will change. I'm sure it will change, but possibly the top ranking will always stay the same as more and more people start answering those questions. So the thing to keep in mind is the combined impact, and that really takes into account the health benefits, and also about reducing gender inequality, that two criteria. And a score of 1 is the lowest score, that means the impact is the lowest, and a score of 4 is the highest impact, and therefore a score of like 3.7 is very high impact. That's how we can interpret those numbers. And on the last column, you'll see urgency. So how urgent is it that we need to address these, the question? 1 is, it's okay, long-term benefit. 3 is short-term. And a score of 2.5 means really we need to be answering it as soon as possible. That's the interpretation. So looking through, and so the way we did it was we ranked it based on the score from the combined impact. So the highest score question that was had the highest ranking was on the question on, do gender differences in the trust, acceptance, and uptake of COVID-19 vaccines vary across social categories? So if you look across the people who responded to these, they felt that was an important question that we have to address with highest impact. The second one is also kind of related to the first one, because it talks about, are there gender differences in the acceptance and uptake of COVID-19 vaccines? Then the third question that was ranked highly was, how do sex and gender determinants of COVID-19 infections, acute morbidity, and mortality intersect with the other social categories? So that's a big project, and it's seen as an important question. The fourth one is really falls in the domain of non-COVID outcome in terms of sexual and reproductive health. And I think this is really important. How have women and girls in low resource settings managed their menstrual needs during the COVID-19 lockdown? I think it's so important. So again, you can see that it's the fourth highest ranked question, and in terms of urgency, it's fairly urgent. In fact, it had a slightly higher score than the others. Next slide, Claudia. Thanks. So the fifth one was relating to communication, really. So the question on, how is sex and gender related vaccine data and emerging evidence communicated to the national policymakers and to the public? And I think that is so important, because we do get sometimes mixed messages between what different governments are saying. So again, here it is considered. I was kind of surprised, because I think in urgency, it was almost like a medium term. I would say it's more important short term, but there you go, it's medium term. But it is considered as a question that would have a high impact. The sixth ranked question was, how does post-COVID conditions affect pregnant and postpartum women and their fetuses, infants across the various contexts? So again, here in relation to sexual and reproductive health, and that's considered as high impact, but perhaps in terms of urgency is more medium. The seventh was what are the biological and social determinants underpinning sex and gender differences in COVID-19 infections, acute morbidity, and mortality? That's a big question, but nonetheless, it is an important one. So that is ranked 7. The eighth one is what are the most effective strategies for debunking myth and countering misinformation about COVID-19 for different groups of women, men, and gender diverse individuals. And so that has, again, in terms of, urgency, it is medium, around medium to short term. And again, impact is above 3, which is high impact. The last two ranked things. Yeah, so it is interesting that the last two that came out was really relating to mental health, and that was ranked 9 and 10. So on 9, it says, how does COVID-19 measures affected the mental health of working mothers when help for childcare is not available, but they still expected to work and manage their households? So that is seen as, again, medium to short term urgency, and it has quite a high ranking. It's been the top 10. And the last one, again, relating to mental health, is what was the impact of COVID-19 measures on mental health outcomes of women, men, girls, boys, and so forth, and gender diverse persons. So that's again seen as having a high impact. In fact, it had a higher impact than the one that was ranked 9, but then the urgency wasn't as urgent. So these are the top 10 that we've summarized from the data that we have to date. And I believe that, while the ranking of these questions will change a little bit, but the bulk of it I believe would still stay the same. And I would like to attach some confidence interval to talk about uncertainty, but we can discuss that later. So I think that's the summary of the results to date. And I think, that's all we have, right, Claudia? That's the last slide.
Yes.
Yeah. So happy to leave it there and can discuss anything you guys not clear or want me to go through something again.
Thank you, Gita. So we have a question from Farah.
Hello, thank you so much for that wonderful walk through this very, very important research. I'm wondering, because I'm doing a study called the COVID Catalyst Study, which is on trying to create health policies to improve women's health despite all of the challenges that we're experiencing. So this is something that I'm also thinking a lot about. So I wanted to ask you 2 questions. If you could talk more about the menstrual hygiene aspects or the menstrual health habits that have been impacted by COVID-19. And I also just wanted to say that I'm surprised that it seems like mental health was kind of lower down on your list, because in my study, which is not a huge sample at all, mental health seemed to be quite high up in terms of health status issues for women during COVID. There was a lot of anxiety and depression. I was surprised that even in my focus groups with experts, that people disclosed that they themselves had been experiencing some severe depression and anxiety. So it just seems to be a really, really big issue, and related to the things that you said of lack of childcare and it's just all the doubling and tripling of the work in the home. Now it's more cooking, more cleaning, homeschooling. It's just everything is just piling up on women. So yeah, thank you.
Thanks, Farah. I'm sure, Claudia, you can add if you want to, but my just understanding at this stage is that I guess, look, the 111 participants or whoever have responded this way, really to understand and unpick what is priority for them, we do need to understand a little bit about the social demographic characteristics of the participants as well. So if they're coming, say, from low middle income countries, maybe things like menstrual hygiene and all that may be more up the list than say some of the other things like mental health. I'm just speculating, but it seems that really for us to understand the questions that they have prioritized, that they think it's important, we will need to understand in what context, so that we could be a lot more targeted when we, talk about it, I guess, a bit more tailored towards the needs. So I think what you'll see is that in a lot of these sort of research, there'll be a lot of heterogeneity, really depending on where they come from, what's their experiences, which country, all that. And I think that those are things that I'm sure the team will take forward in making that recommendations.
I'm really glad you included menstrual hygiene, because pre-pandemic, it was one of those issues that was slowly starting to get a lot of attention, particularly in India. So yeah, thank you for highlighting it. It's really an important topic.
Thank you, Farah. Let me just add that we have in total 41 questions. So these are only the top 10. So mental health in the global scheme of things is high priority, but vaccines or infodemics and menstrual hygiene are still higher priority than mental health. And some of these questions, they may seem a bit repeated. For example, 1 and 2 about the gender differences in the acceptance and uptake of the vaccine. But there are some questions, there's a breakdown that one is only referring to gender differences, and the other question is related to the intersectionality of gender with other social categories. So it means that if, for example, vaccines is important, it takes already 2 spots in the top 10.
Exactly. And the same thing with mental health. There was 2 spots in the top 10 as well. So I think those are all really to think about how we best understand and analyze this ranking.
Yeah. Thank you. Do you have any other questions for Geeta? Okay. If not, maybe Tina, would you like to make some remarks about
Yes, I mean,
priority?
Thank you. We already started the discussion. I hope I can, add something meaningful right now. I'd be curious, to hear everyone else. I was just thinking right now, I think people may end up scoring the impact and also the urgency differently. Like, I think menstrual hygiene is something that I wouldn't say it's more straightforward to put into policy action, but it's definitely, a different kind of a health system response than mental health. And I wonder, how the scoring actually. I think that the Secretariat would be really interesting to really understand people's scoring a little bit. So I first, thanks Claudia and Professor Geeta for this. It was really interesting presentation, because this morning I actually looked at all of the questions and basically top 14. And what I noticed, as I was browsing that dashboard, which was really useful, that so the thematic group 1, the research questions sort of, they reach an expert consensus means impact score quite high, in my opinion, between 3.4 and 3.8. And, these are quite high if you compare them to other thematic groups as a whole. And I think this indicates the growing realization that we can only design and build better interventions and policies to manage the COVID pandemic only if you have evidence to understand the gender differences in health and health behaviors. And, Professor Geeta described the 5 themes across the questions. And what I found really interesting was that they really span across everything from susceptibility to COVID-19, morbidity, mortality, which is the basics of health information and analysis, but then all the way through direct and indirect health outcomes. And this is for both the highest ranked and all questions I reviewed. And I also think that the average urgency within the group is very high. Professor Geeta mentioned this, which I think it's not just because of the high need for the evidence, but also because of probably the feasibility to generate some of the evidence in these research questions. So I really think it's very useful and a broad span of themes that have been identified. because really, when you look at health status and behavior, the gender data and evidence are needed across all aspects of management of COVID-19. Infections and disease and treatment and control and impact, as well as for better epidemic management. Now, the research questions cut across differences in sex and gender, but a variety of different dimensions. When I was looking through this, I looked at all 41, and they're quite broad in nature. So, for example, the dimensions look at the difference in ages and stages of life course, and sometimes they specifically look at young people. But then other dimensions also stand out, and I think this is very important: the socioeconomic status and other social categories like migrant status. And I also noted really an emphasis on aspects of sexual reproductive health, which I think is really good. And what I find really useful is the research questions that also call for evidence from different contexts. And I think this is the ultimate granularity that is much harder to achieve, but very important to inform policy and intervention planning. So to feed into the discussion, there's sort of three reflections as I was looking through that I would like to add to the discussion. The first one is in relation to the mental health, actually. I actually felt this is a really important health outcome to consider. And I think something that might really affect non-COVID health outcomes in this regard is also change in incidence of domestic violence. And that may be considered also in relation to mental health. There was actually quite a diversity among research questions in mental health, like Claudia explained, but this was something that was odd to me, and it didn't stand out. The second part I had was about the emphasis on communicating and using the data and information in policymaking, and this was also right now mentioned. And I think this is, so really making sure that the evidence is taken up in policymaking. This is very, very important for the implementation and the impact of this research agenda going forward. And I can't underscore enough, it's not just a research question, I think it's an implementation action for the agenda as a whole. And then the last comment, it's actually more when I was looking through the research questions, both about uptake of the non-pharmaceutical interventions and the vaccines. There's two themes that emerged there. And, you know, the research questions for both consider risk communication, community engagement, and also incentives. But I think acceptance of any epidemic management intervention, so even actually medical, like treatments and cures, the acceptance can be affected by factors other than access to health information or the incentives. They could be considered and ranked as well. So for example, one aspect that infodemic management considers is how the digital device has differently affected people across different ages, sex and gender in relation to non-COVID health outcomes. Second example, for example, is how gender differences in comorbidities affect vaccine confidence. Because we see this in general in the population, but I really think actually the differences in comorbidities, gender differences actually will hugely impact the risk communication, for example, as well. And then other examples here could be related to other barriers to compliance with non-pharmaceutical interventions or vaccines. And they can be anything: poor access to health services, which I think there are sex and gender differences. They can be related to health misinformation, which we've seen anecdotal evidence that women may be targeted more in certain communities, or something similar like that. And I think looking at removing the high impact barriers due to sex and gender, when you're thinking about compliance, the barriers to compliance with non-pharmaceutical interventions or uptake of vaccines, removing barriers is equally important as looking at incentives to encourage their uptake. And so these were the things that I was thinking. I was really excited to come in basically as a new person into this huge job and project, and I'm really, really keen now to hear everyone else's thoughts about this thematic group and others. So thanks a lot for this. I'm keen to hear everyone else.
Thank you very much, Tina. And just to add also for the others that it was difficult for us to find what will be this very specific theme for each one of these groups. And we recognize there are some overlaps. And for example, as you said, we cannot talk about the barriers for uptake of vaccinations without thinking about access to health services. But this is TG3, thematic group 3, or GBV. It's part of the social determinants of health, but it's very relevant for TG1. So I think maybe in the next phase, we need to look at these results in a more integrative way to see how these research questions, what is the priority compared to the priority of the research questions in other thematic groups. So thanks a lot for pointing that out. So do we have any questions for Tina or Gita, or if you just want to participate and say what is your impression, if for example there are any topic or any question that you would like to see answered that is not here or is not in the 41 questions, please just raise your hand. Farah, you still have your hand up? Is it from before?
Claudia, I have just a comment on what Tina has just said, and what you've just said is I think it's so important that, as you're bringing together all the themes, there's a lot of cross-cutting themes that goes through. So social determinants of health will be sitting across all the different themes, I think, rather than a standalone. But the other thing that is more important as well is that a lot of women are missing out on cancer screenings. And that's something, like with breast cancer screening, bowel, all those things in terms of what we see is maybe indirectly COVID will have an impact on increasing incidence of cancers because of these, the prevention is not taken up, preventive measures. So that's just a comment, really.
Okay, thank you, Gita. I think it's really relevant. I think we will be kicked out in 1 minute. So maybe if you have anything pressing, Nina, please go ahead.
Hello, this is Nina from the Philippines. I was just wondering whether child abuse or domestic violence and teenage pregnancies, they didn't seem to show up. I don't know why. And then just sharing a tidbit with you, the female rural residents in the Philippines seem to be more reluctant to take the vaccine. So I'm surprised that domestic abuse didn't come into our lines of questions. Thank you.
That's a good point.
Thank you. I think there's also a self-selection effect that people who are more the experts more on GBV, they probably picked thematic group on the social determinants of health, so we don't hear from them. So I think maybe this group is more behavioral scientists and epidemiologists, so that will have also an impact on the ranking of questions. Thanks for your comment.
I think how the research agenda will be presented as stories is really important, because these interlinkages are really, really important to make sure the interdisciplinarity is there. So Claudia, I think you have